you, Madam Chair. Last week, the Biden administration told hospitals that they must provide abortion services if the life of the mother is at risk, stating that the Emergency Medical Treatment and Labor Act, EMTALA, preempts state laws that limit abortions. The administration also threatened to defund hospitals that refuse to perform such procedures. Dr. Francis, is such guidance necessary?
So those of us who work in the hospital and see medical emergencies every day have operated under EMTALA, as long as I've been in practice, I've been operating under EMTALA. So there's never been a circumstance where I have not been able to intervene in order to stabilize or save the life of my patient when that is needed. And the other thing that EMTALA also provides for actually is for a pregnant woman, it provides for the stabilization and life-saving attempts for her unborn child as well. And that is how we have always operated. So as long as the directive is that we must intervene in a life-threatening situation to save a woman's life, and if that means prematurely separating her from her unborn child, that's how I have always practiced for my entire 14-year career. And I've never worked in a hospital that performed elective abortions. But those situations where it's a life-threatening condition for the mother, those are not the same as abortions that are intended to end the life of the unborn child. All of us who are physicians would be committing medical malpractice if we didn't intervene to save a woman's life. And again, that's what I have done every day for my 14-year career, and I don't see how that would need to change. I will still be able to intervene to save the life of my patients.
As a pro-life OBGYN, have you ever been able to provide emergency treatments without resorting to abortion? And is there any emergency situation where you can think of where an abortion is the only option?
So if we are defining abortion as the Royal College of OBGYNs defines it, which is a procedure intended to produce the death of a fetus, I have never needed to intentionally end the life of my fetal patient in order to save the life of a mother. There are situations, unfortunately, before viability, before baby can survive outside of mom, where we have to intervene because of a life-threatening complication. But again, that can be done in a way that respects the dignity of that unborn child's life and hopefully deliver mom an intact child that she can hold and grieve. And I can tell you from going through this with many, many patients that they appreciate being able to have their child to hold and grieve. So I fully acknowledge that there are life-threatening complications of pregnancy that we as competent and well-trained physicians need to treat, but that does not require allowing elective abortion through all 9 months of pregnancy for any reason.
Thank you. Would any existing state laws prevent you from treating ectopic pregnancies?
No state law that I am aware of or have seen the text of. In fact, all of the laws that I have seen specifically state that these laws do not apply to the situation of ectopic pregnancy.
Would any existing state laws prevent you from treating miscarriages?
Absolutely not. So a miscarriage is a completely different situation. That's a situation where the fetus has already passed and you are performing a procedure in order to evacuate the woman's uterus of the fetus that has already passed. And so state laws banning elective abortion are not banning procedures in and of themselves. They're banning procedures with the intent to end the life of the fetal human being.
Will overturning of Roe v. Wade lead to an increase in women dying? Why or why not?
No, because we see in other countries that have much more restrictive abortion laws that we do, or countries that have gone from legalized abortion to illegal abortion, they have actually seen their maternal mortality rates drop. What will lead to more women dying is women obtaining abortion pills online without being screened for ectopic pregnancies, and then having a ruptured ectopic pregnancy, experiencing vaginal pain and bleeding, vaginal bleeding and abdominal pain, and thinking that those symptoms are from their abortion, and then wasting valuable time where they should be seeking care, thinking that those are normal symptoms from their abortion while they're bleeding in their abdomen from a ruptured ectopic pregnancy.
Would you speak to what the data shows on the issue of abortion access and maternal mortality rates?
So, again, when we look at, there was a really good study actually done in Mexico that looked at different states that had different abortion laws. And what they found was that the states that had more restrictive abortion laws either had similar or better maternal mortality rates than those that had more permissive laws. And we've seen this in multiple other countries. And again, we have one of the worst maternal mortality rates in the developed world, and yet we have had some of the most permissive abortion laws, out of step with most of Europe and putting us in leagues with countries like China and North Korea.
Thank you. Well, I appreciate you being here to focus on the healthcare of women and how we can improve healthcare for women and children post-Roe.
Thank you.
I yield back.